Welcome back to Get Healthy with Dr. Cooper. My name is Dr. Cooper Dockery. I'm board certified in internal medicine, and I've been practicing medicine for the last several years. But I enjoy educating and inspiring people to use healthy lifestyle choices to improve their health. And today in our show, we're discussing prostate cancer. And I have a friend who is going to come up and help us clarify what is prostate cancer for you to see if you have the cancer and what you can do to prevent the cancer. Hey, Dr. Asasi, welcome to Get Healthy.
Hello.
How are you doing?
I'm very well, thank you.
All right.
Very well indeed.
Tell me a little bit about yourself, Doc.
Certainly. My name is Dr. Asase. I'm a urologist. I've been in practice in this area in South Texas for about 20 years. And a urologist is the specialist that you would see as a man with prostate and concerned about prostate cancer.
Doctor, you have an accent. Where are you from?
Everyone has an accent because they all come from somewhere.
I agree. Where are you from?
Well, I was born in Geneva, Switzerland. My parents came from Switzerland and Ghana, and so I know West Africa very well, and I've spent the last 20 years in South Texas.
Very nice. It's a pleasure having you on my show today.
Well, it's my pleasure also, and I certainly appreciate your accent also.
I'm from Jamaica.
Well, that's an important place as far as prostate cancer is concerned. The highest incidence of prostate cancer is in African American men and in men of Jamaican descent.
Oh, that's very sad for me, though.
It could be, but it doesn't mean that it's the end of all. There are good programs to take care of that.
Thank you so much.
You're welcome.
All right, doctor. So, do you see a lot of prostate cancer in your practice here in South Texas?
Most certainly. Prostate cancer is one of the more common conditions that the urologist would be consulted for, and that is a very common one indeed.
Very good, doctor. What are some of the risk factors for cancer? Who are at risk for prostate cancer?
Older men primarily are at risk for prostate cancer. What does that mean? Anybody within the age of 50 and 70 should be screened for prostate cancer. Risk factors include a family history of prostate cancer. For example, if your father had prostate cancer, if your brother had prostate cancer, if more than 2 male relatives in your family had prostate cancer, would be a risk factor. A big risk factor, unfortunately, is also race. We spoke about it a few minutes ago. If you're African American or of African descent, your risk of prostate cancer is about 5 times the rest of the population. So it is very important that that be looked into and that you have that at the top of your screen in terms of checklists for wellness.
Very good, doctor. We're discussing wellness and lifestyle.
Yes.
Are there any modifiable risk factors? Tell me.
Yes, there are some risk factors that you might modify with lifestyle. A big one is obesity. If you can get your weight down, that would help you considerably as far as prostate cancer is concerned, because in general, we do know that people with obesity are very unlikely to seek as much health care as they should have. And so that puts them at some risk as far as that is concerned. Diet is also an issue, because we do know that prostate cancer, for people who have diets high in fish, the rate is very low, as in Japanese men. Elsewhere, it is much higher. So things of that nature. On the first slide here, we have what's called a sagittal or a side view of a mannequin, if you will. And what it shows is here is your bladder. Below your bladder is a gland called the prostate. The most important thing to note is that there is a small tube from your bladder that comes out through the penis for one to urinate. That tube courses through the middle of the prostate. Anything happening in the prostate that will constrict this tube results in symptoms of not being able to urinate easily, having to strain to urinate, and finding that when you empty your bladder, you are incompletely empty. Those are the symptoms of prostate disease, and it is because of the location of the prostate. It is accessible, as one can see here, through the rectum. So generally, in answer to Dr. Cooper's question, how do you evaluate for the prostate? You do so by having a digital rectal examination where your doctor or your urologist or internist would examine your prostate in this fashion by using a gloved, lubricated finger to determine the size and the configuration of your prostate to determine if you might have a problem like prostate cancer developing. That's where we evaluate the prostate.
Thank you so much, doctor. At what age would you suggest that we start at least screening for prostate cancer?
If you have no family history of prostate cancer known to you, the age of 50 is satisfactory and recommended by the American Urological Association, and that is basically subscribed by all other professional organizations in the area of prostate cancer. Now, if you do have a family history of prostate cancer, that is to say, father, uncle, brother, cousin, have prostate cancer, you need to start screening at the age of 40. So if a man is 70 years old and has prostate cancer and his son is 40, you need to start screening at that time.
Very good. Doctor, what are some of the screening techniques that you recommend?
Yes.
I mean, I do certain things in my office,
Sure.
but tell me, you're the expert.
I think that what you do in your office has been driven primarily by what the experts have told you in the past and updated, refined in a refined fashion on a yearly basis.
Right.
You do a digital rectal examination if you're comfortable with that, and that's really a very necessary piece of it. And the other is that you do a blood test called prostate-specific antigen. This is a blood test that is very important as it signals whether there is something going wrong with your prostate or not, and then compels you then to have it evaluated by a specialist for prostate cancer.
Very good. So I probably do that once a year.
Yes.
Is that good enough?
That is perfectly satisfactory.
All right, so let's go.
Especially if you have had results that have been normal the prior year, what have you, it is perfectly satisfactory to do it once a year.
Right, and then we look at the levels, and if there's an
Yes.
increase in the level of the
Yes.
PSA,
Yes.
then at that time I need to take action,
And the action would be to send the patient or the gentleman to a urologist,
like yourself.
like myself, to be
Correct.
certain that this elevation is not because of prostate cancer that you could treat because it was early.
That's right, I love that. Let's look at slide number 2. What do we have there? All right, doctor, let's see what we have here.
What we have here is a rendition of the anatomy of a normal person with a normal sized prostate, where the channel that you're urinating out of is wide and open. Therefore, your symptoms when you urinate are minimal to none. You don't wake up at night, you don't dribble, you don't have to strain to urinate, and you don't have pain with urination. On the other side, close to Dr. Cooper, you have the same rendition, but you now see that there is a growth of a cancer here which appears somewhat advanced, and its effect has been to compress the channel through which you would normally urinate. It stands to reason when you see this that evidently there is a blockage, and you will start experiencing the consequences of that blockage with diminished force of stream, need to strain to urinate, incomplete bladder emptying, and